You wake up at 3 in the morning. Your tongue is stuck to the roof of your mouth. You reach for the glass of water on your nightstand, and for a moment, you feel every one of your 72 years. Most people blame the bedroom, dry air, the heater running through the night. They buy a humidifier, drink a little more water, and move on. But here is the uncomfortable truth that your physician might not have time to explain during a 7-minute appointment. That dry mouth is not the problem. It is the messenger. When saliva production drops while you sleep, your body is sending an early signal about something happening deeper, often years before a formal diagnosis. And the reason most doctors miss it is not ignorance, it is noise. In a typical primary care visit, you come in for blood pressure, a refill, a stubborn knee. Nobody is asking you to describe the feeling inside your mouth at 3 a.m., so the signal goes quiet. And then one day, it does not. Let me walk you through what is actually happening inside your mouth while you sleep, why it matters far beyond comfort, and the simple sequence of changes our community has used to put real moisture back into the night. Stick with me through the middle because there is a hidden warning sign that appears quietly, often years before any obvious disease, and almost no one is teaching you to look for it. I will tell you exactly how to feel for it later in this video. First, let us translate the biology. Saliva is not just moisture. Think of it as the plumbing fluid of your entire mouth and upper digestive tract. It carries minerals that protect your tooth enamel. It carries enzymes that begin breaking down starches the moment food touches your tongue. It carries antibodies that keep the bacterial population in your mouth from staging a rebellion every night while you are unconscious. When production drops, every one of those jobs stops. Your enamel starts dissolving. Your digestion gets weaker. The bacteria multiply. And the dryness you feel is simply your tissues crying out because the protection system has gone offline. This brings us to the hidden cause, and it is not what most people assume. Age alone is not the villain. Research has been very clear on this point. Healthy salivary glands continue to function well into our 80s and beyond. So if your mouth is dry at night, something specific is asking those glands to stand down. The most common culprit by a wide margin is medication. Antihistamines for allergies, antidepressants, blood pressure pills, diuretics, sometimes called water pills, that pull fluid out of your tissues and leave your salivary glands running on empty. Muscle relaxants for back pain, even common over-the-counter sleep aids. Many of us take 2, 3, 4 of these every single day. Each one on its own may cause a small drop in saliva. Combine them, and the effect stacks like interest on a loan you never knew you took out. Over 30% of older adults on multiple medications experience this dryness, and most never connect the pill they took at breakfast with the parched mouth they wake to at midnight. The second cause is structural. You may be breathing through your mouth while you sleep, and you may not know it. Snoring is the obvious clue. So is waking with a sore throat. So is that morning headache that fades after your first glass of water. Snoring and mouth breathing are often the fingerprints of obstructive sleep apnea, a condition where your airway collapses partially during sleep, forcing you to gasp through your mouth. Studies show more than a third of sleep apnea sufferers deal with chronic morning dry mouth. The apnea is the crisis. The dry mouth is the smoke alarm. The third cause is metabolic. Diabetes, particularly the type that sneaks up on us in our 60s and 70s, can quietly damage the small blood vessels that feed your salivary glands. If you notice dry mouth along with increased thirst, more frequent urination, or a metallic taste, please bring that up with your doctor this week. That combination is worth attention. There are rarer causes too. Autoimmune conditions such as Sjogren's syndrome attack moisture-producing glands directly. Radiation to the head or neck can permanently change saliva output. Nerve damage from surgery or stroke can interrupt the signal between your brain and your mouth. But these account for a small fraction of cases. For most of us, the dryness traces back to a combination of pills, breathing patterns, and metabolic shifts that have been quietly accumulating for years. Now, here is where most people make the dangerous mistake, and I want you to hear this carefully because it is the part that keeps you stuck. The dangerous move is treating the symptom while ignoring the messenger. You sip water during the night. You buy a mouthwash that promises moisture. You chew sugar-free gum. And yes, those things bring relief. But none of them fix the underlying reason your glands went quiet. You are mopping the floor while the sink is still overflowing. Another mistake, and this one can actually harm you, is reaching for a mouthwash that contains alcohol. It feels like moisture for about 20 minutes. Then it evaporates and your mouth is drier than before. Alcohol is a desiccant. It pulls water out of the tissues it touches. If your bathroom shelf holds a minty blue bottle, that is not a treatment. That is part of the problem. A third mistake is assuming dry mouth is just a comfort issue. So let us talk about why it matters beyond comfort, because this is where dignity gets restored. When saliva production drops night after night, year after year, the consequences stack up in silence. Your risk of cavities climbs sharply, especially along the gum line and at the roots of your teeth. Your sense of taste begins to fade, and food loses its joy. Your voice gets raspier in the morning. Yeast overgrows in the warm, dry environment, leading to cracking at the corners of your mouth and a burning feeling on your tongue. And here's the part that should make us all pay attention. Dry mouth is linked to higher rates of aspiration pneumonia in older adults, which is a lung infection caused by bacteria sliding down a dry throat into the lungs while you sleep. That is not a comfort issue. That is a survival issue. So what is the actual home solution? The one that respects your body rather than masking the signal. Think of it as restoring flow to a river that has been dammed upstream. Start with the air you breathe at night. If you snore, if you wake with a dry mouth, even after a full humidifier, the issue is almost certainly airflow. Two simple tests can tell you a great deal. First, ask a partner or set your phone to record audio for 10 minutes after you fall asleep. Listen the next morning for the rhythm of your breathing. Are there pauses? Are there gasps? Second, try this for 1 week. Tape a small vertical strip of porous surgical tape across the center of your lips at bedtime. Not sealing the mouth shut, just encouraging your lips to stay together. If you wake with the tape still in place and your mouth feeling noticeably more moist, you have confirmed that mouth breathing was the driver. If the tape comes off and you cannot tolerate it, that tells you your nasal passages may be obstructed, and an evaluation by an ear, nose, and throat physician is worth your time. Now let us talk about the medications you take. Bring every pill bottle in your house to your next appointment, including supplements and anything over the counter. Ask your prescriber a direct question. Which of these is drying my mouth, and is there an alternative that does not? Sometimes a simple swap of one antidepressant for another, one blood pressure pill for another, can restore saliva production without changing anything else about your treatment. Never stop a medication on your own, but do advocate for a review. Hydration strategy matters, but not the way most of us do it. Sipping water all day is the wrong approach for many people because it leads to frequent bathroom trips and does not actually solve overnight dryness. Instead, try a structured evening routine. About an hour before bed, drink a full glass of water with a small pinch of high-quality salt and a squeeze of lemon. The minerals help your tissues hold on to that fluid. Stop large fluids 90 minutes before sleep so your bladder does not punish you. Place a small humidifier at bed level, not on a high shelf where the mist collects at the ceiling. Set it between 40 and 50% humidity. And consider a xylitol-based oral moisturizing gel applied to your gums and tongue right before sleep. Xylitol also feeds friendly bacteria and discourages the cavity-causing kind. Nutrition belongs in the conversation. Crisp, water-rich foods at dinner help. Cucumber, celery, melon, and a small handful of almonds provide both hydration and the gentle chewing that stimulates residual salivary flow. Avoid alcohol in the evening. Avoid salty, dry snacks after dinner. Avoid mouth breathing during the day too, by the way, which is a habit many of us slip into without realizing it. Mealtime matters. Chew thoroughly. Each bite should be 20 to 30 chews. This is not a dietary rule. It is a gland activation tool. The mechanical work of chewing sends a direct signal to your salivary glands to wake up and produce. The longer you chew, the more your glands respond. This is one of the cheapest, most powerful interventions available, and it costs nothing. Now the warning sign, the one I promised you earlier. Here is the test you can perform tonight, in bed, with no equipment at all. Place 2 fingers gently on your wrist, just as you would to take your pulse. Feel the rhythm of your heartbeat for 30 seconds. Now, while still feeling that rhythm, gently place the pads of those same fingers along the side of your neck, just beside your Adam's apple, or the soft hollow on either side of your windpipe. Feel for the carotid pulse. Now compare. Does one side feel noticeably weaker, slower, or absent compared to the other? Significant asymmetry in pulse strength between your 2 wrists or between your neck and your wrist can be a quiet signal of vascular narrowing. the kind of plaque buildup that restricts blood flow to the glands, the brain, and the heart. This is not a diagnosis tool. Do not panic if you notice a small difference. But persistent, obvious asymmetry, especially paired with dry mouth, jaw discomfort on one side, or new fatigue, is worth raising with your physician this month. The reason most clinicians miss it is that they do not think to compare both sides during a routine visit. You can do it yourself in 90 seconds. Now let us build the permanent prevention plan, the one that protects your moisture for the rest of your life. It rests on 4 pillars, and each one is small enough to begin today. Pillar 1 is airway. Mouth breathing is the single most modifiable driver of overnight dryness. If you can establish nasal breathing during sleep, you have addressed the largest cause. Pillar 2 is medication review. Every 6 months, sit down with your physician or pharmacist and walk through every pill, including supplements. Ask the dry mouth question every time. Pillar 3 is hydration rhythm. Not more water, smarter water. A glass with minerals before bed, a humidifier set correctly, xylitol gel on the gums, crisp, water-rich vegetables at dinner. Pillar 4 is salivary gland stimulation. Thorough chewing. Sugar-free gum between meals, especially after the late afternoon when glands tend to slow. Gentle tongue movement exercises that massage the glands from the inside. Open your mouth wide, press the tip of your tongue to the roof, and slide it slowly backward along the palate for 30 seconds, twice a day. That movement physically encourages the glands beneath your tongue to release. Bring all 4 pillars together and your mouth begins to feel different within a week. Within a month, most of the people in our community who follow this sequence tell me the morning water glass has become optional. The healing is not exotic. It is not expensive. It is the kind of restoration that happens when you stop blaming your age and start working with your physiology. Now, before we close, let me share something that should make this personal. Every prescription bottle in your medicine cabinet, every breath you take through your mouth tonight, every rushed swallowing of half-chewed food is either protecting your salivary glands or quietly undermining them. You have more influence over that little mirror of moisture under your tongue than you have ever been told. The dry mouth you wake to is not your body falling apart. It is your body asking to be heard. If this resonated with you, bring it to your next appointment and bring this exact framework with you. Show your physician, show your dentist, show your pharmacist. The 4-pillar plan works best when your care team knows you are doing it. If you want the exact printable 1-page summary of the 4-pillar plan, including the humidity setting, the xylitol recommendation, the chewing protocol, and the carotid pulse comparison test, join our community by hitting subscribe. Every Tuesday and Friday, I share a new evidence-based protocol that builds on these pillars, and our subscribers receive the practical tools that turn science into daily habits. Ladies and gentlemen, that dessert feeling in your mouth is not an inconvenience. It is a conversation your body is trying to have with you. Answer it tonight, and your teeth, your digestion, your lungs, and your future self will thank you for decades. Now you know what to do with that dry mouth tomorrow morning. Sleep well tonight.